A type 1 error, or false positive, occurs if an investigator rejects a null hypothesis that is actually true in the population. A type 2 error, or a false negative, occurs if the investigator fails to reject a null hypothesis that is actually false in the population. Again, a type 1 error is a false positive conclusion, while a type 2 error is a false negative conclusion. Say what? Well, the difference between a type 2 error and a type 1 error is that a type 1 error rejects the null hypothesis when it's actually true. Again, a false positive. The probability of committing a type 1 error is equal to the level of significance that was set for the hypothesis test. Therefore, if the level of significance is 0.05, there is a 5% chance a type 1 error may occur. So let's assume a biotechnology company wants to compare how effective two of its drugs are for treating diabetes. The null hypothesis states that the two medications are equally effective. A null hypothesis is the claim that the company hopes to reject because they would really like to see that one of the drugs worked better than the other. The alternative hypothesis states that the two drugs are not equally effective, meaning one works better. The alternative hypothesis is the state of nature that is supported by rejecting the null hypothesis. The biotech company proceeds with implementing a large clinical trial of 3,000 patients with diabetes to compare the two treatments. The company randomly divides the 3,000 patients into two equally sized groups, giving one group one of the treatments and the other group the other treatment. It selects a significance level of 0.05, which indicates it is willing to accept a 5% chance it may reject the null hypothesis when it is true, or a 5% chance of committing a type 1 error. So assume the beta is calculated to be 0.025 or 2.5%. Therefore, the probability of committing a type 2 error is 97.5%. If the two medications are not equal, the null hypothesis should be rejected. However, if the biotech company does not reject the null hypothesis when the drugs are not equally effective, a type 2 error occurs. Again, a type 1 error occurs if a null hypothesis is rejected that is actually true in the population, and this type of error is representative of a false positive. Alternatively, a type 2 error occurs if a null hypothesis is not rejected that is actually false in the population. So this type of error, again, is representative of a false negative. Now, it is not possible to fully prevent committing a type 2 error, but the risk can be minimized by increasing the sample size. However, doing so will also increase the risk of committing a type 1 error instead.